So again, we are the Eagles, and I am Daniel.
I'm Han Bui.
I'm Monica Aguilar.
Aznet Moreno.
Marvin Benitez.
Alianza Guerrero.
Christina Boatman.
I'm Kristen Gallegos.
Abigail Bazan.
DeAndre Watson.
And before we discuss the issue at hand, I'd like to tell you guys a really quick story. Before leaving Mexico for Texas, Laura lived with her family in a decent house. You know, she had flushing toilets, she had bedrooms, she had electricity. You know, she had a good way of life. When she moved to Texas for new opportunities for various reasons, she found herself being swindled into paying $187 a month for what essentially equates to a dirt-floored shack. Now, although I'd like for it to be otherwise, this situation is very common in the colonias of Texas. The colonias essentially stretch from El Paso to Brownsville, and they affect 500,000 people. So 500,000 people are dealing with situations like Laura's or worse. And residents of these places tell fairly identical stories. They migrate to this country with dreams of safety and prosperity, and they stick it out in these horrible conditions because they want their children to have access to a better life, to quality education, to various other assorted reasons. And this problem affects more than just residents of the colonias. It affects Texans in general. 25% of Texans lack health care. That's total, not just adults, not just children, but 1 out of every 4 Texans, on average, lacks health care of any kind. And even worse, only 39% of all Texans report that they have a health clinic in their community. So only 39% report that they have access to health care at all. So this information really points towards a larger issue in Texan medical care as a whole.
The lack of health care negatively impacts the community. For example, higher rates of infant mortality rates and early death rates from the elderly have reemerged due to the lack of vaccinations available. It is important to solve these issues in Texas because it will provide an opportunity for residents to have equal access to affordable health care. The current and future development of healthcare will thrive while the quality of life will improve. In response to the increasing productivity, the economy will benefit with a reduction in unemployment rates. Overall, this will help improve Texas's reputation.
The mission of Eagle Care is to unite communities by providing healthcare and education opportunities to create a higher standard of living for all Texans. The mission statement demonstrates the trustworthiness and transparency of this organization.
Now, our goal is to provide affordable and accessible health benefits to rural areas throughout the state of Texas. We will tackle the issue by bringing together resources and then transporting them to these underserved areas. Our organization plans to combine traditional and innovative ideas to create a strategy that will be more beneficial to our state. We plan to create a successful system, learning from trial and error from the past.
We have similar concepts with other organizations, such as the Texas Association of Rural Health. However, we do not require insurance. We are non-partisan. We are non-discriminate, and we are secular. Now, our vision is that Texans will have equal access to healthcare and educational opportunities. We also strive to improve our national rank in healthcare.
There are several steps to monitor the success of our program. The first step is research and funding. We will research the areas and find out their specific needs. Second of all, we will look for the funding and we will use it, whether it be through grants or investors. After this is accomplished, we will move on to establishing our organization. When we establish our operations, we will establish a headquarters and we will hire our staff. In addition, we will also get information out to our patients. As our information gets out to our patients, our care buses will move in. Our care buses will provide basic medical needs or a basic medical service or preventative measures. Our volunteers and intern med students will be under the close supervision of our licensed professionals. And in 5 years, we hope to establish our clinics. Each clinic will be zoned to a specific area depending on their needs. These clinics will help further the already established credibility, trustworthiness, and stable funding of our association. And when we establish these clinics, they will also help us spread our reach out to different areas.
Eagle Care will inform its citizens of our services by flyers, radio, and strongly rely on word of mouth. We will begin our process by sending out care buses to individual rural towns. These care buses will be located in church and school parking lots, open the first weekend of every month in the evenings and in the mornings. These care buses will provide physicals, vaccinations, and preliminary diagnosis by international doctors and intern med students.
As we expand our program, we will review the needs of the town and begin zoning them into areas of central clinics. The mission of these clinics will be to provide stability and to the rural areas and introduce them to the federal healthcare system. They will provide a constant service while increasing productivity.
Now what we plan to do is go ahead and partner up with local schools in order to feed out the information to not only the public but also the youth. We plan to partner up with also churches who hold very prominent positions within these rural communities, also business sponsors and individual sponsors, while also partnering with medical schools within the state of Texas. Last but not least, we plan to partner up with pharmaceutical companies in order to gain access to surplus inventory that we may need for further references. Our opponents that we may face are other nonprofit groups, Medicare, and also insurance companies, to which our nonprofit organization would provide a more competitive atmosphere, to which we open up to a larger selection of the population rather than a more selective group, although they have vested more interest in getting quality health care to many people. Fund seekers and also hospitals, but also like insurance companies, they have also growing interest in providing.
When estimating the various expenditures needed for our nonprofit organization, we estimate the startup cost to be $450,000 over a 3-year period. Our main expenses will mainly be supplies and employees. We plan to cover these expenses through fundraising, sponsoring, and grants. In return, investors will not only receive positive exposure, but will also benefit from a tax deduction due to the 501c3 policy. A sliding scale will be the determination of payment for patients. Any patients without documentation will need a letter from an employer. Those unable to obtain a letter will be required to pay a fixed rate.
I strongly encourage your support of this nonprofit organization. Not only do we strive to give each citizen equal and affordable health care, but we've made it our mission to create a healthier tomorrow and a better upbringing for Texans.
Do you have any questions from the audience? Yes. Can you speak up? We can't hear you.
Is there any type of requirements that you would have for the patients that you would accept into, your care bus?
The patients will be required to provide proof of income, and because there are a lot of immigrants in that area, under the table funds, a letter from an employer would be acceptable, and their income would determine the sliding scale, and if they do make an excess in income, they will not be permitted to attend our nonprofit clinics.
Yes. Can I have someone take me through why Medicare would be opposed to this?
Well, we thought that Medicare would be opposed to it just because we do provide a more somewhat competitive atmosphere to them, but also, I didn't really get to say this, but they can also be a partner in this because they are more invested in providing a more better open population with healthcare. So it can be both an opponent and also partnership. We just need to find out which one.
Where would the middle class citizens fall in the category of this situation?
So middle class citizens actually, it wouldn't even matter whether they were middle-class citizens. It would matter what their income would be, really. If they fit and they fall under the correct spot of the sliding scale, then they will be admitted into our care buses and into our clinics.
Didn't you just say, though, if I have an excess of income, like if they have more money to cover their expenses, that they would be denied from the clinic? Middle class, by definition, would mean that they are making a substantial amount of money.
Well, middle class in our society do not really make a substantial amount of money. Middle class can be considered a $30,000 income. Excess, we're talking starting $50,000, $60,000 a year.
And you really should take into account there's things such as standardized scores of poverty that can kind of determine maybe someone makes a certain amount of money, but children with disabilities, the number of children that they have, and other circumstances would also affect the availability of this.
Yes. Are you aware that the average poverty line is about $40,000 in gross income or lower?
We are. And so most people in rural areas do fall under that poverty line. The poverty level in rural areas is 89%. So if we are opening these clinics in rural areas, there's a very low chance that people with an excess income will be attending our clinics.
But you said that $30,000 was around middle class.
I don't think you're considering that this is rural areas we're talking about.
No, I understand, but she said that $30,000 was around middle class. 40,000 is the.
Okay. You must take into account the amount of children a family would have. $30,000 for one person working and perhaps one spouse is middle class. If they have children, it falls into a different area.
Have you decided which rural area specifically you wanted to start your program at first?
We looked into counties like Cameron County, the Dallas County, which even though have a large population, most of the population is or are immigrants, and they are the area we are targeting. The people that don't have these resources because of fear, because of lack of work opportunities.
Yes. Because of what you just said, the lack of work opportunities, let's say you have an immigrant family who isn't working. I know y'all had said something about, providing a letter from the employer of your income, of the family's income. What if they don't have that? What if they're just not working more and they need the help?
Well, as we said, if they're unable to provide any kind of proof, there's a flat rate. And honestly, if we have a family who, like you said, has zero income and is dealing with these sicknesses and these circumstances, then it's definitely possible that we could be negotiating on a small scale level in terms of possibly covering those costs ourselves.